The Association of American Medical Colleges is pleased to welcome you to today's webinar on optimal strategies for your residency application with a focus on internal medicine. We are recording and we'll make the archive available after. We'll email you once we post it. We did mute all participant audio. If you need help, send us a message. The presentation includes time for Q&A. You may submit a question at any time by clicking the Q&A button at the bottom of your screen. To access resources, including today's slides, please do click on the Handouts tab where you logged in today. It's now my pleasure to welcome Richard Pang. Richard.
Thank you, Jennifer, and welcome everybody again to the webinar on optimal strategies for residency applications with a focus on internal medicine. This is a rerun of a series of webinars from last year. We had only 5 specialties represented last year in terms of sharing the stage for an advisor and a program director on guidance and advice for the upcoming application season. Due to popular demand, it's been re-upped this year with more than 10 different specialties represented. So definitely excited to share more information and do this webinar again with you all. The main target audience is going to be around applicants going through this application cycle, as well as any sort of advisors, student affairs folks, and audience members who are supporting in that aspect. If you are a member of a different community, more than welcome to stick around. We hope that the information you hear is helpful today. In terms of housekeeping, the run of show here is going to be a quick level setter on my part in terms of introducing who we are at the AAMC and highlighting some changes. From there, we are going to incorporate 3 different perspectives, one from a student advisor, and then 2 other ones from a PD from the community, from a community program, and then another PD from a university background too. And then last but not least, we'll also have a bit on the Residency Explorer, again presented by one of our panelists today. So again, it'll be Dr. Kathleen Finn, Dr. Mia Abram, and then Dr. Lauren DiMarino. Quick other piece here is if you'd like to see more of their biographic information, more than welcome to go to the registration page where you'll be able to find more extensive information there. This is mainly just in the interest of time. And then last but not least, many of you and a few of us will do the best that we can to answer as many questions as we can. However, definitely thank you for your patience as we crunch through as many of those as we can. Okay, so let's go ahead and jump right into the AAMC to cover who we are. And so the AAMC is a nonprofit association created to lead and serve the AAMC academic medicine community. This has been our founding since the 1876. As you can see here, there's many different constituents that we support across the board, over 450,000 members. This might be students, program leaders, deans, people like yourselves in the audience right now. And as you can see, there's a lot of different activity that takes place across the board too. The other piece I want to highlight is, of course, IRIS as a part of the larger AAMC ecosystem. You can see on the slide here, there's multiple services that are part of the AAMC, that are part of that ecosystem. I do want to highlight 2 in particular on screen here on the bottom left and the middle bottom. The first being the Dean's Office Workstation. Many of you who are deans in the crowd or those in student affairs that support students may be familiar with this. But just to reiterate, and here, this is not only a tool to facilitate operational support across the year in the application season, but there's a large wealth of data in there from various sources like Vislo, IRIS, the Thalamus interview data that can really help support you throughout the season. The other piece that I want to also highlight on here is going to be the Residency Explorer tool. Dr. Finn will be covering a little bit more of this in terms of introducing it and also highlighting some important updates for this coming year. But again, this is a really helpful tool that we saw last year. 71% of applicants use this tool to complete their MyIris application and compare program characteristics. The last slide here before I hand things over to is going to be a couple changes to the application itself in MyIris. For those of you who are even in the system right now already filling it out, you may have noticed one piece in the postgraduate education section, especially for international medical graduates. We've buffed this up a little bit more to allow for non-ACGME accredited residency education to be included here, and a few more drop-down options that will just give you a little bit more flexibility in showing and displaying that information. The second piece that I want to also highlight is going to be a little bit more universal with regards to extensions and interruptions. This has been a question that has seen iterative change for the past couple of years. And once again, we're refining it this year for this upcoming application season. So definitely take a look at that question. It's been split more clearly between one question around academic content and the other one being around professionalism for any sort of interruptions and extensions. One highlight that I want to make here is that you want to make sure you work with your dean for the MSPE as they're drafting that to make sure it's in sync with your response on this particular question. And then last but not least, I do have 3 QR codes here. It's in our handout section. If you'd like more information, definitely go and check that out, or use the QR codes on the slide itself too. And so with that, I'll go ahead and hand things over to Dr. Rini Abram from the UT Southern Medical Center to represent the advisor point of view and perspective.
Wonderful. It's so good to have everybody here today. Welcome, applicants and advisors. We hope that this is really a helpful session for you. So wanted to start talking about the overview of your application. I know for applicants, this process is new to you and you may not know where to begin, but thankfully, this is not new to us and to many of your advisors, and we really want to help guide you and increase transparency in this entire process. So applying to residency has a lot of similarities to applying any professional job. And for some of you, this may be your first job application. And your application is your first introduction to company, or in this instance, residency program leadership. And you want that introduction to be focused, you want it to be pertinent, and tell a good story. So when thinking about your application, there's a couple of components that you're going to be producing, and that's going to be your personal statement as well as your ERAS application. And then there are a lot of other components to your application that you won't be producing yourself, but you'll be asking other people to produce, and that's going to be your MSPE, your letters of recommendation. It's also going to be your internal medicine departmental letter called your structured evaluative letter. And so that we have resources within these slides so you can take a look at that. Now, before starting your application, a really good place to start is reviewing and updating your CV. Ideally, it's good to do this in the spring. So hopefully you've already been working a little bit on this. And this document, you want to be able to share this with your letter of recommendation writers. It's also a really good starting point for completing your meaningful experiences section of your ERAS application. You want to be able to share this document with some of your trusted advisors, and if you have access, as well as to your school leadership, and you want them to look at it closely and to give you any advice on anything you should change. You want to really spend some time reflecting on your CV and thinking about what these past experiences say about what you value, whether that be service, research, could be leadership as well. And you want to think about how that ties to the profession of internal medicine. How may it tie to different residency program missions and therefore, what you envision for your future career? So, for example, some of you may have worked in an organization looking at new medical devices and technology, and that may really resonate with a program that is focused on health innovation. Maybe you're someone who's earned a distinction in global health. And so that may be a clue that you want to find a program that has more opportunities to do rotations abroad, or maybe they'll have some established global health tracks. You also want to think about the skills and lessons that you have learned from these experiences, as well as from patient encounters, and how that is going to inform how you will practice medicine, and how that can also be unique strengths that all other applicants may not have. And all of these reflections, all of these thoughts really go into you being able to feed into your personal statement. And there's a link here in the slides on an article on 10 steps for writing an exceptional personal statement. Next slide. So when preparing your ERAS experiences, you're going to take that next step in translating your CV and reflections into the ERAS application. So you want to take a very close look at the selected experience section, and you want to look at the prompts, and you want to identify one of 9 key characteristics as well as focus area. And you want to think about how these key characteristics and focus areas fit into how you choose which one of those experiences on your CV you're going to want to share. You want your experiences to focus on your most recent activities through medical school. You don't want to necessarily go way back into high school or something really many years before, unless it was extraordinarily meaningful. And if it was, continued longitudinally throughout your med school career. Now, if you're applying to more than one primary specialty, you really should include experiences that apply to both specialties. I really advise you to work closely with advisors if that's going to be something that you need to do. Now, you're going to select 10 of these experiences to include in your application. And if you have more than 10, you can think about grouping some experiences that are related. So for example, if you happen to work in more than one free student or student-run free clinic, then you could put all of those under student-run free clinics instead of having separate notations for each. And when you're thinking about describing these experiences, you really want to go beyond the who and the when, and you really want to communicate the why and the what next. So why is this experience meaningful? How does it demonstrate your values? What lessons, what skills did you learn? And how does it inform your career? Okay, so how are you going to decide where to apply? I know that's a really thought that's on your mind and can be stressful. So we want to look at this survey from 2024-2025 internal medicine applicants, and these were the top 5 priorities. So you'll see, geographic location, proximity to family and friends, alignment of program strengths with interest, and then the perceived chance of interview offer and matching. So when you're going to be developing your own program list, we want to think about how you can practically approach number 3 through 5 on that previous list. So number 1, you want to think about how you can align program strengths and your career interest as well as chances of obtaining an interview. And we're going to go through these 3 steps in detail on the following slides. But the first is thinking about which factors are most important to you from that list. You want to search databases and local data to gather compatibility information. So you can see there's Residency Explorer, there's also AMA FRIDA, and there's Texas STAR, which is self-reported data. And then you want to consider yourself and your own candidacy applicant and how you can target those appropriately tiered programs based on all of that data. So let's talk about step 1. So when you want to think about, you can go to the next slide. Oh, yes, it does call for a spreadsheet. Yes, sorry about that. Really and truly, you need to organize yourselves and create a spreadsheet when you're thinking about all these factors. Okay, so when thinking about step 1, the basic thing you want to think about is the type of program and how long that program has been around. There's a lot of individual factors too. I won't read through all of them because you will have access to these slides, but you want to think about location, mission, values, and culture, as well as individual characteristics like curriculum, clinical sites, and logistics. Next slide. For step 2 and 3, that's going to be gathering the data. So you want to start to review programs based on the cities and the geographic locations that you're interested in. You want to think about which ones may be in close proximity to your friends and family by looking through Residency Explorer or FRIDA. You want to also go through their individual websites, and you want to look for unique curricular offerings and professional development opportunities. You can also look at social media pages as well to get more information on culture and values that a program really believes in. You want to review match and, if available, interview trends based on applicants that are similar to you, maybe applicants at your own school or the school that you may have graduated from previously. You want to talk with advisors that have access to broad data or this for a large group of applicants, as well as the perspectives of alumni who can speak to important issues such as that mission, values, and culture. You want to share your career interests with advisors and compare all of your application components with what data is available. I think some of the mistakes I may see in some of the applicants I come across is that they may be only comparing part of their application and not really reviewing all of it and how that matches what we see from Residency Explorer, Frida, Texas Star about different programs and what they're looking for. You want to draft a program list that matches your components with the average matched applicants' components from these various residency programs. And you want to get input from current advisors who are really up to date on the landscape, because this landscape is always changing. And you want to consider which programs you want to signal. And before you finalize that list, you really want to talk to trusted advisors to make sure that they can give you advice. And really and truly want to consult on every step of the interview process. So that includes which interviews to accept or potentially cancel as well. So when you're preparing for your interview, you really want to review that application that you submitted. You want to be prepared to talk about what it is that you wrote about. You want to consider formative clinical experiences and how, again, that relates to those values you want to share and highlight during your interview. You want to look at all the resources that are out there. So AAMC has a lot of resources that are available to you, as well as your school may have resources as well. You want to look at the residency program's website to help prepare, answer questions. You want to think about why you're interested in their residency program specifically. You want to think about what questions you have for that program. And you want to practice. You want to practice so much, not so that you're absolutely rehearsed, but you want to practice so much that you're natural. And then tips for advisors. So there's a lot of resources for you as well. So there's that 2026 ERAS applicant worksheet and other application resources. So please go to the website and take a look. You should be playing within Residency Explorer yourself so that you can know what our applicants are seeing. You want to meet with those students individually to go over their application details, their program list, and any specific concerns they have. And you can consider creating your own ERAS account for yourself so that you can practice and play within that environment. It's so important that to send out timely information to applicants regularly. So, just-in-time information such as like how interviews are going, checking in, what's the next step. This process is so nerve-wracking. It's always good to check in and just let people know that, yes, we know that the next step is there. We're here with you to journey on too. And then you want to be able to track the outcomes. So applicant interview progress and timing can also be helpful in future application cycles. And just I want to finally leave you with these helpful IM resources networking. We have a lot of wonderful organizations that are interested in this and partnered. So one is the Alliance of Academic Internal Medicine that has guidelines on the structured evaluative letter resources. We also have our friends at the ACP, SGIM, SHM, and NRMP. So I really encourage you all to look at this data. And now I'm going to hand it off to Dr. DiMarino.
Thank you so much, Dr. Abram. So first off, you can go to the next slide, please. I would like to say congratulations on choosing a fabulous specialty with so many great options for your future. We at the Alliance for Academic Internal Medicine and the Association of Program Directors are really committed to matching the right student to the right program for the right reason. And we're also committed to helping reduce application inflation. But most importantly, equity, fairness, and transparency in the entire application process is paramount. I think it's really important to note that there's over 650 internal medicine programs throughout the United States, and there is a large diversity amongst these programs. And that can include location, type of program, size, the needs of the program or the community, resources, the patient population, and the resident complement. You'll have programs that are predominantly USMD or DO or international medicine graduates or a mix of both. So as we give out our our advice today, please note that there is going to be variation amongst programs because of this. So, as many of you know, internal medicine has been offering tiered signals for the past year, and we've learned a lot from that. And our advice is, from a program's perspective, we use signals as an indicator of program interest when we're allocating interview invitations. However, it's important to note that this isn't the only factor that programs use to select candidates. Because we know that applicant interest can change significantly post-interview, programs have been advised not to use program signals as a consideration for rank list decisions. And we've also been given guidance to indicate on our program websites how we intend on using signals. Different programs will do different things, and here's some examples. Some programs are unlikely to extend an interview offer if an applicant does not signal them. There are other programs that will preferentially review applicants who signal, but will consider applicants who do not. And there are programs that don't use signaling to inform their decision-making process for interview offers. And one thing to note here is that signals are sent to an institution, not a specific track. Meaning if you're applying to both a preliminary position and a categorical internal medicine position, or you're applying to a categorical internal medicine or primary care track, your signals are going to that institution, not each one of those entities. So from the applicant perspective, we advise that if you are interested in a program, signal it. You should use all of your signals if you're applying to 15 programs. And it is also advised that if you have a home institution or you've done an away or an audition rotation, that you signal that program if you are interested in applying. This is an equity, this was done out of equity because not all applicants have a home institution, not all applications get an opportunity to do away rotations. And you may not want to go to your home institution, and they won't know that. So it's important to signal if you're interested. Signaling a program for which an applicant is deemed qualified may increase your likelihood of obtaining an interview. However, if you signal a program for which you are not necessarily qualified, it's unlikely that a signal will increase your likelihood of obtaining an interview. And it's really important, if the information is out there, to review how each program will use signals. So do your homework and go review websites. You should also distribute your signals to a range of programs, including reach and safety programs. And it is really important, if you have a faculty advisor, that you work closely with them to determine which programs you should signal based on your specific application qualifications. Next slide. So this slide shows the relationship between sending a signal and interview invitation rates by applicant type, and is reflective of the 2024-2025 application cycle. So it was found that applicants who signaled were interviewed at higher rates than those that did not, compared to their peers. It was also noted that the effect of signaling was stronger for USMD candidates at 61% gold and 42% silver, compared to DO applicants, 42% gold, 40% silver, and international medicine graduates at 11% gold and 6% silver. Interview invitation rates were lower for all applicants that did not signal, but USMD applicants who did not signal were slightly more likely to be interviewed than DO or IMG applicants. However, more research is needed to understand these findings. For example, this descriptive result doesn't control for applicant qualifications that could also help explain differences in interview rates. Communication with programs is something we'd like to touch on. A signal is your way of communicating and sharing interest with a program. But it's important to note that just because you signal a program doesn't guarantee you an interview. However, programs do consider them strongly. And we ask that you use signals in lieu of pre-interview emails, because we as program directors get hundreds of emails pre-interview to review applications. So your best bet is to signal the program if you're truly interested. Next slide. And geographic preferencing has been around for a while, but program directors recommend one of two things. When you look at your list of programs that you're applying to, if they are located in 1 to 3 geographic regions, we recommend you signal those regions. However, if you don't have a preference of where you do residency, you truly don't have one, then say that you have no preference. If you don't select a geographic area or you don't select no preference, we on our end see that section blank. So our assumption is that you selected other geographic regions, not ours. So it's important that you either signal the regions or you say no preference. This slide shows the interaction between program signals and geographic preferences for the 2024-2025 application cycle. So applicants who sent a gold signal had the highest interview rates, and that effect was strongest for those whose geographic preferences aligned at 44%, followed by applicants who had a silver signal and an aligned geographic preference at 29%. And it's important to note that interview rates for applicants who did not signal were near zero, regardless of geographic preference. Next slide. So at AIM, we really have worked hard over the past many years to try to continually enhance the application process. And we have some reaffirmed recommendations and new recommendations this year that I'd like to share. So in our recommendations this year, we reinforce that programs should only offer as many invitations as interview spots available. But new this year, we are recommending that programs extend interview offers on Tuesdays and Fridays after 3 p.m. Eastern Standard Time. The reason for this was to hopefully preserve morning time for applicants' educational experiences and create a more predictive, concentrated time when invites should be extended or expected by the applicant. It's also recommended that programs clearly communicate on their website what day and time interview invitations will be sent, and that they allow at least 2 business days for applicants to respond to interview invites before releasing the spots to other applicants. And we also recommend that programs communicate applicant status with them as timely as possible and indicate on their program website how and if communication will occur. Next slide. And lastly, I would just like to mention new for the 2026 residency match season. The NRMP is partnering with internal medicine, pediatrics, and vascular surgery, and is launching a voluntary rank order list lock pilot. This is designed to address applicant concerns about post-interview visits affecting their rank. This pilot will allow programs to voluntarily lock their certified rank list early, and once locked, applicants can visit or not without influencing their rank status. So I'm going to pass it on to Dr. Finn, who will talk to us a little bit more about Residency Explorer.
Oops. Thanks so much. I'm excited to be here to tell you about this tool. I'm here representing academic university-based residency programs, but I'm going to chat a little bit about the Residency Explorer tool, which we're incredibly excited about. This tool is designed for residents or for applicants to find their right program. And the advantage of this tool versus all the other things on the internet is that it's pooling data from multiple organizations, including the AAMC. It's pulling in interview data and program level data. It's pulling in data from the ACGME, which residency program directors fill out and sort of put information in about what they're looking for. It pulls in data from the AMA and FRIDA. It's pulling in data from the NRMP and number of program positions that are offered and filled. And now it's going to be pulling in data from the USMLE exams and the COMLEX exams. So all of this is getting pulled into this one place so that you can actually go in and look at programs. So next slide. So in looking at these programs, there's a couple great things. One, it allows you to look at program level data to assess the program and what they're offering and whether what they're offering aligns with what you're looking for. So you can look at the size of the program or the type of the program, whether they're university or community-based, where it's located. You can look to see whether it has tracks or offers research or what are the benefits that the program's offering. So it gives you a lot of information there, and then you can compare programs based on all this information. You're always welcome to go to a program and look at their own website, but the nice part about the Residency Explorer tool is that it allows you to compare programs. There's also a whole bunch of data on competitiveness in terms of who gets interviews, which I'll go through in a minute. And then lastly, the nice part about it too is that you can go in and create a personalized profile, largely it asks you a series of questions so you can actually start to think about what are you looking for in a residency program, again, to allow you to sort of use this tool to see if I put in these requests, what comes out, like what does the Residency Explorer tool, which programs does it match me with? And in some ways, the hope with this tool is that it'll actually expose you and introduce you to programs you might not have thought of, because suddenly what you put in that you're interested in aligns with what has been pulled and information from that program. So next slide. The nice part about Residency Explorer tool is that they take feedback from all of us. They've been working with the AAMC and AIM. They've been working with residency programs to improve it. They've also been taking feedback from applicants to really make this tool as rich as possible. So it's being updated again this summer. So first, for those applying in 2 fields, and we know up to 40 to 50% of IM applicants apply in 2 fields, you'll be able to use this tool to look at other specialties, not just internal medicine. It is now going to pull in more data about programs and what program directors are looking for, including you can look to see the number of letters of recommendation that they're requiring, whether they require away rotation, audition rotations, whether they accept USMLE and COMLEX exams. They're even pulling in information about how much time the program will allow between medical school graduation and when you would start your residency. So all of this information is being pulled in. In addition, this year, they're pulling in exam scores. So you can see what the average scores were for applicants who got interviews at this program. And then you can also, this year, they're separating out the primary care tracks and the physician scientist track. So you can see the number of interviews and acceptances in those other areas, not just the categorical IM. And then the other new feature this year is something called the program highlights, which the programs are putting together. And they're really a very short snippet of what makes this program unique. So again, as you try to think about what you want, you can try to match it up with the program highlights to find programs that sort of describe what you are looking for in a training program. Next slide. So I wanted to take a deep dive for a second just in this competitiveness component, because I think a lot of people are going to look at this. And this data really reflects the program interview rates. And what it's providing you information on is, of the people that got interviews, what percentage were signaling, gold and silver, how many signaled geographic alignments, how many signaled, who among the applicant types, whether MDs, DOs, or IMGs got interviews. It's going to pull in the exam results of the people who did get interviews, and it will look at in-state, the percentage of people who get interviews from where medical schools were in-state versus out-of-state. So it is giving you snapshots for who this program is offering interviews to. Next slide. But I do want to remind you and caution you when you look at this data. This data is descriptive. It's based on last year's interview cycle and the last year's applicants who were interviewed. And now remember, in internal medicine, these 15 signals are new. Last year was the first time we used them. So this is 1 year of data. And so just keep that in mind, that it is not a hard fact. These are largely descriptive based on 1 year of information. And I know that many programs are still adapting and changing their strategies on how we're using signaling. So please don't use this as a hard, in fact, I won't get an interview. These are descriptive informations of how it was used last year, and we're all learning from this process. The other components of this data is each item is a single characteristic. And as you know, as Dr. DiMarino described, we all look at all the data combined. So the hard part with looking at just these facts is that just looking at signaling versus geographic alignment versus applicant type doesn't quite give you the richness of what we're looking for. We are looking for everything together, but the data is obviously displayed as one characteristic at a time. So just this information is to help you imagine, would I be someone that might get an interview here, but I wouldn't rule anything in or out purely based on this because it is just descriptive and based on 1 year. Next slide. So if you go to the AAMC webpage, there's an entire website here that describes the Residency Explorer tool. There's some really great videos on how to interpret the data, how to use the tool, and what it means and where the information is coming from. And then you can go in and actually put in your profile and start comparing programs and searching for programs. And I suspect you will all uncover programs you hadn't thought of that are a really good match for you. And that is the goal of this tool. Next slide. And then I just wanted to take a pause because I know this country right now is a little, things are not going well for those on visas. This is the percentage of programs who, of IM programs and the visas we take. So you can see a large number of IM programs take applicants on J1 visas, smaller on H1Bs, and then the OPT is a 1-year visa that some programs take. If you are looking for programs and want to figure out which programs take H1Bs, you can use the Residency Explorer tool to find that. You can also go to the AMA FRIDA website to search for this, and the AAMC also has a search tool so you can find programs that take applicants with these visas. So that is Residency Explorer in a nutshell, and I will turn it back to Dr. Ping. And these are some of the links that you'll get these slides. You can look for information about Residency Explorer.
Thank you, Dr. Finn. Just Mr. Richard Payne is fine. Not a doctor on my end, but appreciate that. So we'll go ahead and switch over to the discussions of questions portion of today's webinar. So I'm seeing a lot of questions in the queue already. Some of these questions that we're going to tackle are going to be firm registration, so there should be some overlap there. And then as the questions are going on, I'll try to weave in some live questions as well. So for this one, we'll go ahead and start with this. What is the latest one can update clinical experiences and or board exam scores for it to be useful in this cycle? There are a few questions in the queue just asking, around that September 24th opening for applications, is there a particular approach applicants should take when getting their materials in for their application? So I'll go ahead and direct it to Dr. Finn first, and then we can maybe follow up with DiMarino.
Sure. Yeah, I would say that, we are going to all start looking somewhere between September 24th and September 27th at applications. I would say get your information in by then. I get over 3,000 applications, and many places go in and we download this information and then we start looking. So we are not going to go back and pull things in addition. So I would just make sure you have everything in by the time programs do start looking. If you get an interview at that program and there's more information, you're welcome to then let the program know that you have additional information, but I would try to get it in by the time we all start looking at applications.
Dr. DiMarino, anything to add there?
I completely agree with Dr. Finn. We all tend to look on day one, and we may not go back and look again because we have so many applications. So as complete as your application can be on that first day, I think that's really important. And because step one, level one, has gone to pass fail, many programs are really looking at step 2, level 2. So having that score in by the 24th is going to be really important.
Awesome. This next question has to do with, I guess, one's medical school experience and between that and when they start applying for applying for residency. Any kind of thoughts on this at all in terms of that gap? Can start with you, Dr. DiMarino.
Yeah, I think it really depends on what was done in those gap years and how long they were. If you were away from any clinical experiences during, 5, 6, 7, 8 years, that's different than if you, after completing medical school in your home country, you ended up doing a residency there, or you worked as a house officer or did something clinical. I think a lot of programs will put on their website what the year of graduation, cutoff is. We tend to say 2 years, but there's certainly exceptions to that. So I think I would explore individual programs and see. But I think it really depends on the program and what they're looking for.
Dr. Finn, anything to add with regards to the Residency Explorer and GE track data?
Yeah, I mean, this is I believe, gonna show up in Residency Explorer. We do all put it in our GME track survey, so you could also look at the AMA FRIDA data. And I agree that it all depends on what you did between medical school graduation and starting residency. Many, some international medical grads do a fellowship, in which case that gap won't count because we'll have seen that you were doing a clinical residency, so or clinical fellowship. So it really just depends on what you did between the time.
So, this next question is actually centered around the training and track types. Can you discuss how application strategies should differ from when applying to preliminary versus categorical internal medicine positions? I did also see a couple questions in the queue just asking what is the categorical training or what is a preliminary training. So if it's possible to kind of start off with this with just a quick definition, but I'll go ahead and start with Dr. Abrams if that's okay.
Yes, so their difference is categorical internal medicine is the 3-year internal medicine residency program, whereas preliminary internal medicine is the 1 year that you start off with that usually feeds into an advanced specialty such as dermatology or radiology or PM&R. So those are very different types of programs. And so they have very different application strategies. First, not every program has both a categorical and a preliminary medicine program. So you really need to know for each program, like which programs it does offer, which positions it offers. If you find yourself in a position where you are applying to both preliminary and categorical internal medicine, as Dr. DiMarino shared, there are only 15 signals per program, and so it does not separate by track. So, for example, if you were applying to preliminary medicine, you're applying to dermatology, and you have a backup of categorical internal medicine, you will only have 15 signals for all of your preliminary and categorical internal medicine programs to be able to use. So we don't advise, if you're having to use that strategy, to apply to both preliminary and categorical at the same program. We do advise for you to use those signals at different programs. The other thing we often advise if you do find yourself in that situation is that you should probably be applying to transitional years as well, because that's a whole different set of programs and signals.
Awesome. Anything to add, Dr. DiMarino, Dr. Finn?
I mean, I would say many program directors vary in their thoughts. I think some program directors in internal medicine are worried that they are giving interviews to people who are applying in other fields, and therefore they are concerned if they see an applicant apply to to their institution in both the preliminary and the categorical program, because it suggests that you are also applying to, say, ENT or derm and looking for a prelim program, as well as applying to internal medicine. And to the program director, internal medicine program director, that implies that internal medicine is your backup. And so I would definitely suggest not applying to an institution for both their prelim and categorical, because they will see that. And then it may hurt your chances of getting an interview in the categorical program.
Thank you. Let's go ahead and move on to the next question. So it goes, I would like to know more about how to manage or approach any sort of clinical course remediation or even board failures in the application. There's some questions that are coming in through queue in terms of how they might compensate for past failures, just approaches to the different exams and potentially how that might display in the application. I'll go ahead and turn it over to Dr. Finn first, if that's okay, in terms of approaching this question.
Sure. I would say that, you definitely, for a board failure, you want to take it again and you want to really try to do well. And then I would definitely put in your personal statement, what happened, right? Better to be honest and not bury this, because unfortunately for some programs with many, many applications, they're going to be using the step 2 scores in some ways for screening in or out. And so that would be, I would definitely take it again, try to do well, and then acknowledge it in your essay. And the same would be true for if you failed a rotation, to explain that in your essay. And yes, it likely for some programs could hurt you. I don't think there's any way around that, but there are enough IM programs out there that especially perhaps smaller programs that have more time to look and get fewer applications, they may have time to look at the whole application.
So, anything to add, Dr. DiMarino, Dr. Abrams?
I agree with Dr. Finn. It's going to show on your application in one way or another. And the best thing to do is be very transparent about it. And I would recommend, as Dr. Finn did, to talk about that in your personal statement. What happened, what you learned from it, how is it not going to happen again, those kind of things. That's your best way, I think, to communicate, that specific circumstance, whatever it may be.
Yeah, I would agree. I think it's also really important to work with a trusted advisor on really the programs that you're going to select for application. There is information from programs on whether or not they'll take people who have failed step 1 or step 2 on, if they needed to pass it on the first try or not. So I think knowing that information, so looking through that is really important. Completely agree with sharing not only, the circumstances, but the lessons learned, right? Like, so what did you learn? And how are you going to, moving forward, help that and how it's part of your growth. But yeah, I think really targeting your application, there's over 700 programs. So as Dr. Finn and Dr. DiMarino shared, you really need to be thoughtful on who it is that you send that application to.
Awesome, thank you. I'll actually take a moment here to reiterate one piece in terms of those competitive questions about like board exams. Residency Explorer tool is a great place to kind of find out more information about that. And the other point I want to also remind is earlier I did mention there was a slight adjustment to the application for this year in terms of the interruptions and extensions. And that is an area where you can share your perspective for clinical and course remediation. But remember, that is focused on academic clinical course remediation. If you have any sort of board remediation that you have to do, make sure to work with your advisors and those who draft the MSPE to make sure you're in sync for that particular piece of the application.
Oh, can I add one more thing, Richard, on?
Yeah, of course.
Is I also think when you're working with your advisor is really making sure, if you had a clinical course remediation, you're really making sure that your letters of recommendation are also like really strong. So making sure that your advisor is helping you, that you're picking a good person to write your letters of recommendation.
Awesome, thank you. So let's go ahead and move on to the next question. I think there were a number of questions in the Q&A about, perception of not showing a preference for where you end up, or showing a preference, or how program directors might perceive that. The question here goes, how might you as a program use all the geographic information, including other parts of the application that kind of reflect that, such as the permanent address, medical school location, especially when reviewing applications. Is it okay if we start with Dr. Finn, and then Dr. Abrams, maybe you can share how you might share guidance around that?
I would say that the geographic information or geographic choices or preferences matter. If I see that you've picked, for me in Boston, if you've picked New England or said no preference, that's sort of what I'm looking for. With over 3,000 applications, I am not looking at people's addresses. I'm not looking at their medical school locations. It's just, we're overwhelmed by the volume of applicants and information coming at us. That is very different. I know from program directors, and Dr. DiMarino can probably address this, at some smaller community programs in what we call flyover states. If you are from that area or grew up in that area, that matters a lot. So it really just depends on the program.
I concur. I think using Residency Explorer to see how programs used this information will be really important. We've collected local data on where our applicants got interviews, and it is really different program to program. And so it really is, I think, talking to the advisors about the specific programs you're interested in and specific strategies to see if they have data that they can help you with this, and using the data that's presented to really help you see how people use geographic signaling or program preference signaling will be important.
Before I go to a follow-up question, Dr. DiMarino, did you have anything to add on that front?
Yeah, I'll just say, I mean, I'm from Pennsylvania. It's technically not a flyover state, but we do have a challenge recruiting to our area because we are more rural. So location does matter to us because we tend to recruit people that are from Pennsylvania or the surrounding areas. So it is part of one of our filters as we're going through the 4,000 applications. There's got to be a way for us to weed it down. And not that we don't look at people outside of that area, but if there is a connection to the state or to the area in some way, that is something that we do look at. But again, it is really going to be very dependent on the type of program that you're applying to. So, you know, as you can see, even between Dr. Finn and I, we have different strategies and how we recruit based on, you know, our location and the type of programs we have.
Awesome. And so that, speaking of specificity, one of the aspects of sharing geographic preferences is the ability to share a quick blurb as to why you selected that particular geographic preference. Any thoughts on approaching that particular section? Any sort of guidance for that statement? And we can start with Dr. Abrams and then share the respective program perspectives.
Yeah, I think being honest is always a good. You want to be honest, but you want to look at the number of programs that are within that. So you don't need to be so very specific, but you just want to be honest about why you're interested in that area. If it's something where, again, it's, you know, it's the New England, but you're really interested in one state, and all your programs are in that state, then I think it's fine to be a little bit more specific and tell those programs that the reason why you're interested is because your you know, your social support group is located nearby. So yeah, in general, you don't want to overshare, but it's good to be honest and so that people know that you have a sincere interest.
Awesome, thank you. Let's keep this show going. This next question has to do with scholarly work. What are your general views on scholarly work, research, and the influence it has on the applications and the review process? Is there any difference for the different applicant types? I know there's a lot of IMGs in the crowd asking questions about this, DOs, MDs. I'll kind of toss this at Dr. Finn first, if that's okay.
You know, I think in some ways we're looking to see that you did other things in medical school besides just clinical rotations and study. So I wouldn't say that I mean, it depends on the residency program, but most of us are looking for people who have shown curiosity and interest in other areas, and that's really what we're looking for. So is it just research? No. I mean, people that do research, it's great. We're happy to interview them. We're also looking for people who led organizations or ran a homeless shelter. Like we're always looking for people who have just done other things. I think that makes the applicant richer. And I would say each program that interviews was likely looking at slightly different things, but for the most part, everybody's looking for a well-rounded applicant.
Thank you. And I'll make a shameless plug here. The AAMC, our selection sciences team, is doing a webinar on debunking the myths around publications, the publications arms race or research arms race. If one of my team members can share in the chat for folks to take a look at that. It is next week, so feel free to register for that. The next piece, I'm going to go ahead and move on to the next question here. There were a number of questions here, I think, around just applying to different specialties. So with regard to parallel plans, what kind of guidance is there for those applying to multiple specialties? How can an applicant present their narrative without necessarily portraying IM as a backup? So I'll go ahead and turn this over to Dr. Abrams first, if that's okay, and then follow up with the program perspectives.
I wanted to hear from the programs first.
Excuse me, the other way around. The other way around. We'll start with
Yeah.
Dr. Finn and Dr. DiMarino.
I'm assuming, and I don't know this for sure, that you can write different essays for a prelim application versus a categorical versus your other field. Because if I got an essay describing how important dermatology is to me, I certainly would be very skeptical about your application. So I don't think you need to tailor the application for a specific the essay for a specific residency program, but I would definitely, for each application, I would feature your activities and put in your essay that the field that you're interested in applying to for each place that you apply. So write an essay for internal medicine for a categorical IM program. If you're interested in, radiology, then maybe your prelim essay is going to look different.
Dr. DiMarino?
Yeah, I would say, and Richard, correct me if I'm wrong, but the experiences don't change, right? What you put in for experiences, they are the same regardless of what type of program you apply to, but the personal statements can be customized. So I agree with Dr. Finn that is an opportunity. I will say, I think because we have seen an uptick in applicants that have ended up matching into other specialties, it is something on our radar when we're reviewing applications to try to determine genuine interest in internal medicine. I do look at where the letters of recommendation are coming from. Are they coming from anesthesia, or are they coming from neurology or PM&R? That to me is a little bit of, I kind of puts my radar up a little bit. And I also look at the experiences that people put down. And I will say, there's coming into medical school, many people don't know what they want to do, and that is completely fine. And you're going to get involved in a lot of different clubs and organizations that you may not end up going into that specialty. But what I have seen applicants do on their applications when talking about those experiences as meaningful, explaining, yeah, I was the president of the emergency medicine interest group, and I learned a lot about leadership and what my role is in that. But it's not what I want to do anymore. It was just, that's what I got out of it. And a lot of times they'll call out that they've changed their preference. If you are applying to both, though, you do need to be careful in that regard, because programs will see that. So I would just say, be honest as much as you can, and probably use the personal statement to help to explain why internal medicine.
Yeah.
I'm gonna, yeah, sorry, anything to add there, Dr. Abrams?
I know we're coming up on time, but so I will say that work with a trusted advisor on your strategy. It's going to really depend on what your other specialty is. I mean, from the advisor side, I work with a lot of applicants who I am as a backup, and some end up matching in their other specialty, but a lot match up in their backup. And so backups are important. And so I would say work with your trusted advisor, because depending on your primary specialty and where that application is and the signaling, you would have a different strategy. I will say, if IM is your backup, the first thing to think of is IM an appropriate backup, or is it not an appropriate backup because of of certain characteristics. So I would go through that exercise. And then the second thing is I would actually think about for yourself doing the reflection and convincing yourself that it is something you want to do. And if you can't do that, then it shouldn't be your backup.
Awesome. Thank you. Thank you. I know we're down the wire here. I do want to include this question because there's a lot of IMG questions around here in terms of how to prioritize their activities. How much do you weigh U.S. clinical experiences for IMGs, and how can they potentially strengthen their application? I'll turn this over to Dr. Finn if it's okay, and then we'll tie things up with the last few comments.
Yes, I would say internal medicine program directors very much value U.S. clinical experiences. It's a way for us to sort of evaluate an international medical grad in terms of how they're going to do compared to U.S. medical grads. So I would say try to get U.S. clinical experiences, and hopefully ask if you do well, ask the people who you did the experience with to write you a letter. But that is really one of the best ways to strengthen your application. And then the other thing that matters, again, if you have trouble matching in a transitional year or a prelim year or doing a fellowship that didn't fill, gives us a chance to see how you're going to do in U.S. graduate medical education training. And that actually helps to have a letter from a fellowship director or a prelim program director or transitional program director.
Awesome. Thank you. Thank you. And now we're down to the wire here in terms of the last few seconds. If you don't mind kind of going down quickly in terms of any sort of last few comments or thoughts about applying to IM for this season. I'll start with Dr. Abrams, then Dr. DiMarino, then Dr. Finn, if that's okay to close us out.
Yeah, welcome to the specialty. And, we're so excited to have you. There's so many programs, a lot of diversity. Use the data that's out there and really work with advisors to really help, really strategize and get you the success you need.
I would say, yeah, it's a fantastic field. There's just so many opportunities. It's a great specialty to match into. And I think there's such a wealth of information out there between Residency Explorer, individual websites for programs, social media, do your diligence, look around. You can learn a lot from social media if programs are on there about the culture of the program and things that they value. So that could be a good tool. But also a lot of programs are very transparent in things that are, what their programs like on their websites. And Residency Explorer has a really great opportunity to match things that are important to you to programs that also value the same thing or have similar things that they're looking for in applicants. So definitely use those resources, but good luck.
And I would just add that we know this is a stressful adventure to go through. There's a lot of unknowns, and we definitely, given the number of questions of people on the call, we know this elicits a lot of stress. I would say the best thing to do is just be yourself in this process. Don't try to game it. Don't try to pretend you're somebody else or emphasize things that aren't true to you. Use the Residency Explorer tool to figure out what aligns with your interests. I think the more honest you can be about what you want, you'll have a better luck matching in a program that is right for you.
Awesome. Thank you so much, Dr. Abrams, Dr. DiMarino, and Dr. Finn. Great panelists again for this year, and thank you all in the audience for joining us today. I have on screen here other specialty webinars that are available or coming up. If you're an advisor or student affairs folks that are interested, feel free to register for those along with any of the other webinars that we have. And with that, I'll go ahead and say best of luck, and I'll turn it over to Jennifer to close us out. Thank you so much.
Great, thank you. Please do fill out the evaluation that will pop up on your screen as soon as we end. We did record the session. We'll email you once it's posted. On behalf of the AAMC, have a great day.